This is the famous study in 1993 that changed the course of treatment for people with type 1 diabetes and anybody who has a type of diabetes that needs insulin, intensive insulin therapy. In June of 1993, after an average follow-up of 6.5 years, the Independent Data Monitoring Committee determined that the study results warranted terminating the trial. The significance was so huge that they could not go on to give traditional insulin therapy to people, knowing how intensive insulin therapy was so much better for long-term outcomes, for long-term health, your vision health, your kidney health, your cardiovascular health, your whole body health. If you work to keep your blood sugar in range as close as possible. And they tried to get people to have their blood sugar match normal people's blood sugar, people who do not have diabetes. And one of the most confusing things today is that there's a different target for what the target you should be aiming at if you are using insulin to manage your diabetes versus if you are a person without diabetes. It is so hard to get that target into the normal range that we say if your A1C is under 7, that you're doing a great job managing your diabetes. Whereas under 6 would be the number we'd want for an A1C of somebody without diabetes. And as the technology improves, there's discussions of should we be looking for a completely normal number target goal for somebody with diabetes. But you have to look at the stress of diabetes, the stress of the technology, the danger of going low, and look at like the long-term complications. And if you get an A1C under 7, will that be good enough to prevent the long-term complications? And much of the research today does believe that that will prevent the long-term complications.